Disordered eating behaviors. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide. Patients with type 1 diabetes mellitus are at high risk for disordered eating behaviors (DEB). Due to the fact that type 1 diabetes mellitus is one of the most common chronic illnesses of childhood and adolescence, the coexistence of eating disorders (ED) and diabetes often affects adolescents and young adults. Since weight management during this state of development can be especially difficult for those with type 1 diabetes, some diabetics may restrict or omit insulin, a condition known as diabulimia, as a form of weight control. It has been clearly shown that ED in type 1 diabetics are associated with impaired metabolic control, more frequent episodes of ketoacidosis and an earlier than expected onset of diabetes-related microvascular complications, particularly retinopathy. The management of these conditions requires a multidisciplinary team formed by an endocrinologist, diabetologist, a nurse educator, a nutritionist, a psychologist and, frequently, a psychiatrist. The treatment of type 1 diabetes patients with DEB and ED should have the following components: diabetes treatment, nutritional management and psychological therapy. A high index of suspicion of the presence of an eating disturbance, particularly among those patients with persistent poor metabolic control, repeated episodes of ketoacidosis and/or weight and shape concerns are recommended in the initial stage of diabetes treatment, especially in young women. Given the extent of the problem and the severe medical risk associated with it, more clinical and technological research aimed to improve its treatment is critical to the future health of this at-risk population. Diabetes mellitus has been found to be the sixth leading cause of death for those living in the United States, affecting the young and old people at an alarming rate. Type 1 diabetes typically has an early onset in life but can occur at any age. As the majority of patients with type 1 diabetes are children or adolescents, the nutritional anomalies have important consequences. To be diagnosed with diabetes represents a very hard experience that requires subsequent psychological adaptation. Unfortunately, this often does not occur and is followed by frustration and the non-acceptance of the disease. The management of diabetes and its associated health risk factors are often complex and require considerable patient education and frequent medical monitoring. The participation of patients is basic in order to obtain a correct degree of metabolic control, however, this carries a considerable amount of stress as a consequence. People on insulin must learn how to regulate their blood sugars by monitoring blood glucose levels daily while carefully attending to their food intake and an exercise regimen. Careful blood glucose monitoring is necessary to prevent wide variations in blood sugars that affect both short and long-term health and functioning. Hypoglycemia reactions are a concern in the short run not only because they are frightening and disruptive, but also because, when severe, they can lead to unconsciousness, coma and death. The three diagnostic forms of eating disorders (ED) are anorexia nervosa, bulimia nervosa and eating disorder not otherwise specified. Common to all three is a core problem in which self-evaluation is unduly influenced by body weight or shape. According to the Diagnostic and Statistical Manual of Mental Disorders 4th ed., anorexia nervosa is an eating disorder characterized by refusal to maintain a healthy body weight and an obsessive fear of gaining weight. It is often coupled with a distorted self-image which may be maintained by various cognitive biases that alter how the affected individual evaluates and thinks about her or his body, food and eating. Bulimia nervosa is characterized by binge eating, or consuming a large amount of food in a short amount of time, followed by an attempt to rid oneself of the calories consumed, usually by purging, vomiting, and/or by laxatives, diuretics or excessive exercise. ED not otherwise specified are described as disorders of eating that do not meet the criteria for any specific eating disorder. Type 1 diabetic patients have a high risk of suffering from ED as these patients have to select the food they eat carefully in an early period of their development, and because both entities, type 1 diabetes and ED, often affect adolescents and young adults. Furthermore, adolescents with type 1 diabetes also suffer from other anomalies related to their eating behavior since they commonly diet or exercise to control weight and to overcome body dissatisfaction. Other adolescents, mainly girls, may present more severe misbehaviors such as splitting insulin doses or restricting food intake in order to reduce their body weight, binging and purging, using laxatives or adhering to an overly strict exercise regimen. All the above-mentioned misbehaviors are called disordered eating behaviors (DEB). In this study, we will review these psychological anomalies suffered by type 1 diabetic patients, especially DEB and ED, and also discuss some aspects of their forms of presentation, management and prevention. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide.